Good afternoon, everybody. Thanks for joining us. As usual, I will give the report on the COVID statistics for today. The total number of positive cases reported yesterday was 775. That's 12.6% of people newly tested and takes the total number of cases now to 30,687. 324 of the cases were in Greater Glasgow and Clyde, 164 in Lothian and 102 in Lanarkshire. There will be a meeting today of the National Incident Management Team, and they'll be taking a look obviously at a range of issues, but in particular at the current situation in Glasgow and Lanarkshire. The remaining 185 cases were spread across 9 other health board areas. I can also report that 175 people are in hospital, which is an increase of 21 from yesterday, and 19 people are in intensive care. That's 2 more than yesterday. I also regret to report that 4 deaths have been registered of people who had first tested positive for COVID during the previous 28 days. The total number of deaths under that daily measurement is now 2,526. And again, I want to send my sincere condolences to everybody who has lost a loved one. And of course that particularly includes those who've lost a loved one in the last few days. Obviously these numbers today, not just of cases, but perhaps more particularly hospital admissions, numbers in intensive care and the numbers of people dying really should remind us that this resurgence of COVID is something we have to take very seriously. Now, I've got several issues I want to briefly update on today. Firstly, as I often do on a Friday, I want to draw your attention to an announcement made last night. The Scottish Government has now added Poland and Turkey to the list of those countries subject to quarantine restrictions. We've also added the 3 islands of the Caribbean Netherlands, Bonaire, Saba and Statia. And that means that from 4 a.m. tomorrow, people travelling to Scotland from these places must self-isolate for 14 days upon their return. Madeira and the Azores will be removed from the list of places which are subject to quarantine restrictions. However, if you have arrived from those places in the past 2 weeks, or if you arrive later today or tonight, you will still have to self-isolate for 14 days. These changes are yet another reminder that levels of the virus in any country or any area can change quite rapidly. And when they change, our quarantine rules often change as well. So please, and this is especially important as we approach the October holidays, think carefully right now about any unnecessary travel. In fact, if possible, avoid unnecessary overseas travel. And remember that the fact a country is exempt from quarantine requirements when you go there does not necessarily mean that it will still be exempt when you come back. Second update relates to the Protect Scotland app. I've said before that the app is not a magic solution. It doesn't replace the need for the hard work being done by our Test and Protect teams, but it is a really important additional tool in tackling COVID, and it is already proving its worth. More than 1.3 million people have downloaded the app. In the past 3 weeks, more than a third of the people who have tested positive have been app users, and during that time more than 2,000 contacts have been advised to self-isolate through the app, and these are people who might not otherwise have been identified. However, there are 3 points that I want to stress which might make the app more useful. The first applies to everybody who currently has it. If you test positive for COVID, you will receive a code which you're then meant to enter into the app. Please make sure that you do that because it is necessary for you to do that, for the app then to automatically notify people you've been in close contact with. Now that might sound very basic and obvious, but we know that at the moment not everybody who has the app and who receives a positive test result is actually doing that. Now, enough people are doing it for the app to be making a difference, but it would obviously be better if everybody entered the code when they test positive. So please remember to do that. Second point is that we issued an update to the app this week, which some people may wish to take advantage of. It allows the app to be paused without Bluetooth being disabled in your phone. Now, let me stress first of all that I don't want people to pause the app when you're going about your day-to-day activities because that would remove the point of having it. But this is a feature that is especially useful for some groups of people, in particular perhaps clinical staff, in jobs that often involve being within 2 metres of other people, but where significant measures are in place to reduce the risk of infection, for example, wearing medical-grade protective equipment. We're also looking at other improvements that can be made to the app. For example, we are working really hard just now with NHS England and the NHS in Northern Ireland on linking up Protect Scotland with the apps in those countries to support people who travel, to make these different apps interoperable. We're also looking at whether the age limit for the use of the app can change. Right now you have to be over 16, and we're looking to see whether it might be possible to reduce that in the future. But the final point I want to stress is that if you haven't downloaded the app yet and you are able to do so, please do it. It takes less than 2 minutes. Your data is kept entirely secure and anonymous, and it is a simple, but it's a really powerful and important way in which we can all play our part in the struggle against COVID. Now, lastly today, I want to stress again how important it is that all of us self-isolate when we are asked to do so. Obviously, I can't do that today without first addressing the issue of Margaret Ferry, the SNP MP who travelled by train to London and attended the House of Commons after taking a test when she should have been self-isolating, and who then travelled back to Scotland by train after being told that her test was positive. Now, Margaret is a friend of mine, so everything I'm about to say is obviously with the heaviest of hearts. And of course, I wish her a speedy recovery from COVID. But none of that changes the fact that her actions were reckless, dangerous, and completely indefensible. And I feel very angry on behalf of all of you. Every single day I stand here and I ask you to make horrendous sacrifices as part of our collective efforts against COVID. And it's really important, whether you agree with me or not, whether you love me or loathe me, that you can have confidence in the advice that I give you. And that means me being clear that the rules apply to everyone, regardless of who you are and regardless of what your political allegiance is. Trust me, it's one of the easiest things in the world in politics to call for tough consequences when one of your opponents breaks the rules. That's not hard for any of us. The litmus test, though, is whether you're prepared to do the same when it's one of your own breaking the rules. And in these abnormal times, when everybody has been asked to do difficult things, I think that is more important than ever. That's why the SNP whip has been withdrawn from Margaret, and that is the most serious sanction a party can impose on an elected representative. I've also spoken to her directly and made crystal clear to her that I think she should now resign as an MP. Now, people contact me and say, why don't you just sack her? And this is a point that I have to make clear. I don't have the power to force an MP to step down. No party leader has that power. But I can make my views known, difficult though it is, and I have done so. And I hope she will come to the right decision in the interest of the overall integrity of these vital public health messages. And I want to emphasise again why it is so important to self-isolate. We are launching a media campaign actually this evening, which has been planned for several days, to stress the importance of self-isolation. Essentially, if you have any one of the symptoms of COVID, you should start to self-isolate immediately and you should book a test. You can do that through the NHS Inform website. The symptoms, as a reminder, are a new continuous cough, a high temperature, or a loss of or change in your sense of taste or smell. When you get your test result, if you test negative and don't have COVID, you can stop self-isolating at that point. However, if you have COVID, you need to self-isolate for a further 10 days, starting from the day on which you took your test. And if you are identified as a contact of someone with COVID, either by a Test and Protect team or by the app, then you must self-isolate for 14 days. You need to self-isolate for longer than someone who has tested positive. That's because if you get COVID, your infectious period will start a few days after the infectious period of the person you got it from. And the key point I want to stress today, for obvious reasons, is that self-isolation is not something anybody can or should see as an option, as something that is voluntary. If you develop symptoms or if you are identified as a contact, you must self-isolate immediately. Don't think you can go to the shops one last time let alone travelling any longer distances. And you must self-isolate completely. That means staying at home and not going anywhere else. The reason is simple. If you've been in touch with someone who has COVID during their infectious period, there is a chance that you will also have COVID, even if you don't yet have symptoms. And self-isolation is one of the most important things we can all do to ensure that we are not, unwittingly sometimes, transmitting the virus to anyone else. So this is essential. It's a tough thing for any of us to be asked to do, but it is an essential thing that all of us must abide by. And if we are asked to do it, no matter who we are and no matter what our circumstances are, we should all do it. It's inconvenient, it's tough, particularly for those on low incomes who might lose money when asked to self-isolate. That's why we are introducing the £500 support payment, and it's why we're working with local authorities to ensure there is practical help available to people for things like food deliveries. And details of all of that are available also on the NHS Inform website. But the reason we provide help for people to do the right thing is because right now doing the right thing for all of us is so important. So please self-isolate and book a test if you have symptoms of COVID. Self-isolate for 14 days if you're identified as a contact. It is vital to our collective efforts against the virus. Now, I've stressed that particular point today. I was always going to be stressing that point today, but it has particular added resonance given circumstances that I have already alluded to. But before I finish and hand over to Jason, I also want to provide the usual reminder of the other key public health guidance that we're asking everybody to follow. None of us should be visiting each other's homes right now, except for very specific purposes like childcare or caring for a vulnerable adult. When we do meet with others outdoors or in indoor public places, the maximum group size allowed is 6, and those 6 people should not come from any more than 2 households. We should avoid car sharing if it's possible, work from home if we can, download the Protect Scotland app, as I've already talked about, and finally, all of us should remember facts. Face coverings, avoid crowded places, clean hands and hard surfaces, keep 2 metre distance from other households, and of course self-isolate and book a test if you have symptoms. I know I say this every day, but I feel a particular responsibility to say it today. I know how hard it is for everybody to follow these rules right now, and I know how angry people feel when they see others not following these rules. But we're being asked to stick with all of these rules for the collective well-being of the country and for each and every one of us. So please do that. Do it for yourselves, your families, your loved ones, and for your community as a whole. And my thanks, my deep and sincere thanks to everybody who is making really tough sacrifices right now in the interests of that collective effort. Jason.
Thank you, First Minister. Today I want to make a plea on behalf of a piece of the health service that we perhaps take for granted. Not every country has a blood transfusion service, and we have one of the best in the world, the Scottish National Blood Transfusion Service. And firstly, I'd like to thank this remarkable organisation that we often do take for granted because it is invisible to many of us for the life-saving work they do every single day. And secondly, to give a huge thanks to Scotland's blood, platelet and plasma donors who have provided an amazing response during the pandemic. It is vital there are supplies of blood for patients in Scotland at any time, but particularly important right now. And that brings me to today's particular plea, and the Blood Transfusion Service asked me personally to do this today. As health services restart, the demand for blood across Scotland is also increasing. Blood donations are needed from people who are able to donate, especially as we move towards winter. So if you have never donated, or if you haven't recently donated, and you're able to do so, I would really urge you to contact the Scottish National Blood Transfusion Service to make an appointment to donate. I want to reassure anyone who's considering making a donation that arrangements are in place to ensure your safety at donor centres. They have increased social distancing, they have PPE, exactly as you would expect. Donation sessions are now run only by appointment, so there are the right number of donors at any given time. Anyone with symptoms of COVID or who's been in contact with anyone with symptoms, of course, should not donate. The Blood Transfusion Service is also working to advance the fight against COVID by collecting convalescent plasma at their donor sessions. And this is my second plea. Research is showing that the blood of someone who has recently recovered from COVID may contain antibodies which we can use for treating people in hospital who are seriously unwell with the virus. So the blood transfusion service is looking for new donors of convalescent plasma. So if you've had COVID, either a confirmed positive test, or you've self-isolated because you've had symptoms, and if you are now symptom-free for 28 days, the blood transfusion service would like to hear from you. Please can you check your eligibility to donate and book an appointment at scottblood.co.uk. Thank you, First Minister.
Many thanks, Jason. We'll move now straight to questions. Firstly, today, Gerard Tubb from Sky.
Hello, First Minister. Thank you. I hope you can hear me. The Margaret Ferrier incident, it highlights the fact that people are adapting the rules to meet their own circumstances. Did the MP tell you why she thought it was so important that she goes to London? And what does it tell you about why people are not following the rules?
Look, people are finding it really difficult to follow these rules, and there are a variety of reasons for that. Some people, the rules are complicated, more complicated the more we've come out of lockdown, and at times different rules apply in different parts of the country. So I understand, I think the vast majority of people want to follow these rules for the right reasons. Some people perhaps don't fully understand them. That's no criticism because they are complicated. Sometimes people will inadvertently breach the rules. I'm struggling to put what Margaret did into any of these categories. The one rule that has been clear and unchanging really throughout this is the need to self-isolate when you have symptoms and get tested. And then if you test positive, to absolutely make sure you complete that self-isolation. There can be no dubiety about that. And this is not a minor breach of the rules. It's not an inadvertent breach of the rules. It's a really flagrant and dangerous breach of the rules. And I'm struggling. I've spoken to Margaret. She certainly couldn't give me, she absolutely accepts, and let me make this clear, she accepts without reservation that she has made a very serious mistake and error of judgment. I should say, for completeness, she has voluntarily, of her own back, referred herself to the police and to the Standards Commission. She is not trying to evade responsibility for this. But can she give me a cogent explanation as to why she did it? No. But in a sense, that doesn't matter. Nobody can have an excuse, really, for that kind of breach. Travelling on a train when you know you're positive with COVID right now is possibly the worst breach imaginable. And I say this, I really, look, I think people can probably understand my feelings for a whole variety of reasons right now. I can't excuse this, and I'm not going to try to excuse it, and nor is Margaret. But what I can do is use the circumstances to make it clear to people that these rules apply to everybody. Nobody can be exempt, and nobody can be exempt from the consequences when they breach them. And to try to take some positive out of this, use the inevitable publicity around this just to underline to people why we are asking for self-isolation in these circumstances. And that's what we'll continue to try to do. Gordon Cree from STV.
Thank you. Just on Margaret Ferrier, when you asked her or suggested to her you thought she should resign from Parliament, what did she say to you about that? Can you help us with who knew what, when? There is a suggestion that the whips knew about this on Wednesday, and I just wonder if that delay between people knowing about it and her going public and being suspended suggests that there was initially an attempt to try and ride this out, and whether she's been fully honest all the way through the process with the party and others. And separately, if I can ask Jason Leitch, on the figures in the last few days, to what extent do you think students are still a big chunk of driving this? And are we, by the sounds of it, looking at possibly further restrictions in Glasgow?
Let me take 2 points to me first, and I'll be as brief as possible, but I want to be as open and frank as possible. On my conversation with her, I've been very clear. I think she should step down. I say, and I mean this. I do that with a really heavy heart. Margaret is somebody I've known a long time. I like her, but I can't defend what she's done. And I think in the circumstances right now, the integrity of these public health messages and my ability to stand here and look at this camera and say the rules apply to everybody is too important for me to, try to protect somebody who just happens to be a friend and a colleague. So that's clear. She didn't tell me one way or another what she intends to do. The other thing I'm very conscious of right now, and this, again, I'm not going to say anything that tries to excuse it, but I have to bear in mind the fact that she has COVID. She, you know, I asked her how she was, obviously, and thankfully so far she is not suffering serious symptoms, but this can be a nasty virus. So obviously I am concerned to know that her health is okay, and, you know, so these are all factors. But my duty is to make clear to her as her party leader, but also as First Minister in the position that I am dealing with right now, what my views are, and that's what I've done. On the who knew what when, you know, these are important questions, but, you know, sometimes I think in politics there can perhaps be too much political opportunism around some of this. We're all guilty of that in normal times. I think in these abnormal times we should perhaps be less so. Can I say, before I go into that in some detail as briefly as I can I say that my absolute understanding is that she fully cooperated with and went through the test and protect and test and trace as far as England and the House of Commons is concerned, fully. So people who might have been in contact with her have all been properly identified and contacted in the same way. So whatever I'm about to say about timelines does not affect that. People were properly notified if the test and protect and test and trace thought there was a need to do that. My understanding is that the SNP at Westminster knew on Wednesday that she had tested positive, but believed that she had taken a test once she had arrived back in Scotland. I understand that she had informed colleagues on, I think, Monday evening that she was travelling back to Scotland because a family member might have been unwell. It was not until yesterday, and my understanding is that this information came through the House of Commons test and trace mechanism. It was not until yesterday my colleagues in the House of Commons realised the circumstances that she'd actually taken the test before travelling to London and then travelled back having been told that she was positive. The first I knew anything about Margaret Ferrier having COVID was yesterday afternoon, shortly after I ended First Minister's questions. I think people can imagine my reaction to being told that. Obviously, partly because I was struggling to comprehend how anybody could have acted in that way. I was anxious to make sure I was properly understanding all of the facts and not getting any essential details wrong. I was told two other things at that point. Firstly, that the House of Commons wanted to put out a statement first, confirming that an MP had tested positive. I then made clear that if that was to happen, Margaret should immediately then issue a statement confirming it was her and what the circumstances were. I was also told that Ian Blackford, the leader of the group in Westminster, who was on a plane travelling to Inverness at the time, was due to speak to her once he landed in Inverness. By the time that discussion took place, the position with the House of Commons had changed, so it was made clear to Margaret she should issue a statement with all of the circumstances, and before she did that, she referred herself to the police, and I understand that she took a little bit of time to inform people close to her that she had COVID, and the statement was issued early evening yesterday. So look, I know that politics kicks in these things, but I think the SNP has acted quickly, appropriately, and actually we have not tried to protect a colleague here. We've tried to do the right thing given the circumstances we're dealing with. And I'm not going to get involved in kind of political statements here, except to say that some of the people I hear last night and today, you know, full of self-righteous criticism of the SNP, are people who completely lost their tongue when a certain special advisor in London broke the rules himself. So as I say, it's easy to be critical when it's your opponent. The big test is whether you're prepared to do the same when it's one of your own. Sorry, Jason, there was a part of Gordon's question.
There was. Thank you, Gordon. I mean, my summary is the numbers across the whole of Europe and in Scotland are going in the wrong direction and continue to do so. To illustrate that beyond the daily figures, which is perhaps a trend, 3,573 people have caught COVID in this country in the last 7 days and tested positive. We have 19 patients in intensive care, and you've just heard an increase in hospital admissions of, I can't remember, maybe 20 or so in the last 24 hours. We've also had 11 deaths in 48 hours. Our per 100,000 rate is 63.1 in Scotland, and Glasgow City is at the top of that unfortunate league table. The National Incident Management Team will meet again today, as it does consistently throughout the week, and it will look at the numbers. It will look at trends in Lanarkshire, in Lothian, in Glasgow. You're right that many of those positive cases still are in halls of residence and in the student population. That doesn't reassure me particularly, as you've heard me say many times from this podium. That will leak into a more vulnerable community, and you're not immune if you're a student of a serious illness. So all of the numbers are going in the wrong direction. However, 2 weeks ago, we put in place really quite severe household restrictions. They will not have played through into the numbers yet, and I am hopeful they will. I can't guarantee it, and it relies on each of us following the rules, every single one of us following those rules in order to drive those numbers down. If the National IMT give advice to Gregor and I, and then we give advice to the First Minister and the Cabinet, then that will take its course. Today, there are no existing plans to tighten up restrictions in those local authorities.
Thanks, Jason. Liz Bates from Channel 4.
Hi, First Minister. So back to Margaret Ferrier, if you don't mind. I just want to ask you something slightly broader on that. You are setting these rules, telling people that they must follow them. And yet this isn't the first time that we've seen this, politicians and public figures just ignoring them and acting like they can do whatever they want and that these rules don't apply to them. So the public will be asking this question yet again, and so I'll put it to you. Is it one rule for you and one rule for everyone else? And just one more question, if you don't mind. Is there anything that you specifically can do to stop another incident like this, particularly in relation to your own MPs, to stop something like this happening again?
No, there's not one rule for us politicians and another rule for everybody else. And the only thing I can do to make that clear is insist on the consequences when a politician breaks the rules being as severe and taking account of the circumstances of elected representatives and the responsibilities they have as they would be if it was an ordinary member of the public. I'm being pretty clear about that. It's not easy, and I'm not asking for sympathy, the last thing I'm asking for, but it's not easy as a politician to effectively ask one of your own MPs to resign. It's not, for a whole variety of reasons. And in normal circumstances, on more normal political issues, maybe you try and avoid that happening. But right now, the most important relationship I have right now is the one I have standing here looking down the camera at the Scottish public. And I can't ask you watching this right now to make all of these sacrifices if I'm going to stand here and try to explain away what Margaret Ferrier did. And I won't do that. And I think, I can only speak for myself. I think other politicians who might have decided to do things differently have to explain that. What can I do to stop any of my other colleagues doing this? I can't babysit everybody across the country, but I can just be crystal clear. People have to abide by these rules because they're not there for no reason. They're there to keep us all, or try to keep us all safe. Jason has just talked about the numbers we're seeing. These numbers are broadly reflected across the UK and many parts of Europe and the world right now. This is a serious global pandemic we face, and I don't like being in a position of standing here asking people. I've had to ask people not to visit elderly, frail relatives in care homes. I had to ask students last week to stay out the pub for the weekend. Maybe these two things are not entirely equivalent. I'm asking families across the country right now to stay out of each other's houses. And I can't do that if people who should know better don't lead by example. So, I believe my colleagues take that very seriously. This was a monumental, actually almost incomprehensible error of judgment on Margaret's part, and I can't make my feelings on that, I think, any clearer than I am doing. Katrina Renton from the BBC.
Good afternoon, First Minister. First of all, I was going to ask you about Margaret Ferrier with regard to the rules and people understanding the rules. Is it the case, perhaps, that facts and the rules have become so complicated that people don't, including your own MPs, don't know what to do? I put a caveat on that from what you said about the fact that Margaret Ferrier told the whips that she was going back to Scotland to deal with a family member. I'm wondering what your reaction is to that. And to Professor Leitch, 48 hours to get a test result seems to be how the position that Margaret Ferrier was in. Is that too long to wait? Can results be speeded up and then this would never have happened?
I'm going to I always try to keep myself calm here. It's not the fault of the testing system that somebody didn't know that when they had tested positive, they shouldn't get on a train. Now, you've heard me talk about the need to have speedy turnaround of tests. Many people get tests in 24 hours. 48 hours is the absolute, maximum we want to try. And when it's longer than that, we work hard to try to get it back into the normal time frame. I know that some of these rules are difficult. Actually, that's one of the reasons why I have chosen to keep doing these briefings every day, to try to do what I can to minimise any room for confusion and to be as clear as possible about what the rules are. But I know they can be difficult for people to understand. So actually, there are some occasions where people inadvertently breach a rule that is quite complicated, where, I'm not going to stand here and say it's okay, but I'm likely to be more understanding of it. And if somebody, after taking a test, before they've got the test result, maybe feeling okay, travels there, that's really wrong. But again, at a stretch, it would have to be a really, really long stretch. Okay, maybe you just didn't fully understand. I'm not sure an MP can really use that excuse though. But I come back to, there surely can be nobody in this country who doesn't know that if you have a positive test for COVID, you should isolate yourself, and you certainly shouldn't sit on a train for 6 hours with taking a 450-mile journey. Margaret is a friend and colleague of mine. I would love nothing more to be able to find an excuse and to be standing here saying, look, there is an explanation for this and let's cut her some slack. I can't do that. I can't do that. And if I tried to do that, then frankly, what right do I have to ask any of you to do all the hard things I am asking you to do? So I don't relish being in a position of one of my colleagues having done this. I don't relish having to phone up a colleague and tell them I think they should resign as an MP. But the importance of these public health messages right now is just so absolute that that's my biggest responsibility right now. In fact, right now, that's the only real responsibility that I have, is to do everything to try to keep us as safe as possible. And I'm afraid that means I just can't stand here and try to make excuses for inexcusable behaviour.
The premise of your question is, of course, correct. The quicker the test, the quicker the contact tracing can be done. That's why we need the test back fast. But the reason the self-isolation rule exists from symptoms is to make the country safer from the moment you have your symptoms. So even if the test is a little bit delayed, you are still isolated and you are still off the street, and therefore you can't give the virus to anybody else other than perhaps the people in your household, and even then you should be self-isolating from them. But fast tests, responsive test and protect is absolutely crucial in this fight, and we're getting better. The test results, the little backlog we had, we've worked our way through that across the country. The test results are coming back faster, and 24 hours is kind of the international standard to get the test result back, and then you try and do all the contact tracing if you can in the following 24 hours, and that gives you the best chance of interrupting these chains. But remember, you've heard us say it a number of times now, to be completely clear, you self-isolate from symptoms, not from test.
Right, we've got still a large number of questions. We've been joined by a lot of journalists from network media today for the first time. So Libby Wiener from ITV.
Yes, First Minister, why should anyone in the general public listen to what you've been saying when one of your own MPs has blatantly ignored all the advice you've been giving from that podium over the last 6 months? Her continued defiance today, not deciding to resign, doesn't that undermine your entire public health messaging?
It's good to have you joining us today, Libby. I'm not sure if you've listened to what I've been saying for the last half hour. It's because I want people to listen to the advice, and most people will continue to listen to and abide by the advice, not because I'm telling them, but because they know it's really important for their own health and the health of people they love. But it's because I'm not prepared to have that undermined, that I'm not going to stand here you know, think up lots of weasel words to try to excuse the inexcusable conduct of a colleague. And that is, you know, that's basically why I'm saying to people that I think she should resign, because what we are dealing with right now is too important for us to compromise it because of party allegiances or friendship or loyalty in that way. We are all in a global pandemic, and our conduct, every single one of us, our individual conduct doesn't just affect ourselves, it affects everybody around us. And so, you know, I can't be clearer. I am not prepared to excuse inexcusable conduct. And the reason for that is that it is so important that all of us continue to follow this. And I know people will feel angry. I know people, it's human nature to say, why should I do all of this when an MP doesn't? Well, it's the MP in this case that is in the wrong. Everybody who's following the rules are doing the right thing. And they're doing the right thing not just because people like me are telling them to do the right things, they're doing the right things for the greater good of the country. And that's the spirit that I hope we will all continue with. Anas Hassan from Kingdom FM.
Thank you, First Minister. It has emerged that motorsport events in Lochgelly and Fife, which have been taking place with spectators recently, should not have gone ahead with spectators, but did so after the council apparently gave them the wrong advice, for which the local authority has apologised for a misunderstanding over the correct guidance. How concerned are you that a situation like that can arise? And one other issue, on the topic of live events, we've had calls from one of the council co-leaders in Aberdeen to ban what's being called a seat rave event in Glasgow with music in a marquee. What's your stance on that?
On the first issue, I'm afraid I don't have the detail on that. I think Jason's got the detail on that, so I'm going to hand over to him on that. On the issue in Glasgow, I have asked for a review of the legal position and the health position around the event in Glasgow to make sure it's within the rules and would not be breaching any public health guidance. And obviously, I will look at that when I get it.
So I was equally disappointed to see the Lochgelly crowds, let's call it that. I first saw it on social media. We investigated it. Your answer is correct. You've answered your own question. It would appear that the wrong information was given to the organisers. That has now been corrected, and there shouldn't be crowds at that sporting event. We have postponed pilot events. We've certainly not allowed crowds at any other sporting event. Now, football is clearly the iconic one, but that applies to rugby, netball, hockey and stock car racing. So that should not happen again until we give permission as we move, I hope, out of this pandemic. For the Glasgow event, the First Minister is also correct. We've sought clinical advice from some of my colleagues. The Deputy National Clinical Director is looking into the guidance today, and there's also legal advice being sought about whether that event, I think, slightly exaggerated in social media and in the media, actually, from my understanding of it, is within the guidance, and then we will advise the organisers whether they can go ahead or not.
Certain outdoor events are permitted within the current guidance, but subject to very strict rules and restrictions. So we are checking to make sure that this event would be within those very strict rules and restrictions or not. And we'll, as Jason says, give advice accordingly. Phil McDonald from Global.
Thanks, First Minister. Just to return to the Margaret Ferrier situation, can I clarify, was it the English COVID app that she had on her phone? If so, is there any ongoing concern for people she may have come into contact with when she arrived back in Scotland, particularly those who were on the train with her? And I know you touched on it at the start of the briefing, but how close are you to resolving the issue that one of my colleagues raised last week, so that Protect Scotland and the NHS COVID app can run on the same phone?
To be perfectly honest, I don't know what apps she had on her phone, but what I have been told is that she has gone fully through both the Test and Protect system in Scotland and the Test and Trace system in England. I also understand that the House of Commons has its own Test and Trace facility, so she has done all of that, and those who have been identified as contacts, and I don't know how many that would be, have been given the appropriate advice. So as far as I am aware, there is no concern that the proper procedures in that respect haven't been fully followed. On the point of the apps, I indicated it in my opening remarks, we are working, and it's work in progress, to make the Scottish app and the English and Welsh app fully interoperable, and also the Scottish, Northern Ireland and the Republic of Ireland apps. There are what's called federated systems. Now, because our app works on the same software as Northern Ireland and the Republic of Ireland, it is likely that that bit of the interoperability will be achieved first, but we hope with not too much time after that, we will have that interoperability with England and Wales as well, because it's important. That means people can travel wherever they want across the UK, knowing that the apps will work and they can put codes in one part of the UK into an app in another part of the UK.
It's important to say that, just to correct your question slightly, you can have more than one app on your phone. What you can't have is more than one app active on your phone at the one time. So in your settings, you can switch between the English and Welsh app and the Scottish app. If, for instance, you're travelling between those two countries, you can do the same across France or Northern Ireland, and you should activate the app for the country you are in. Now, that's not perfect, of course, because if you enter a 6-digit code, it's going to be in one of the apps. But you can have more than one app on your phone. If you are a traveller, you can only put the code into one. And if you're in Scotland, that will be our 6-digit code.
And that's a good point. And, you know, I'm not travelling outside of Scotland at the moment, but I downloaded the English and Welsh app to my phone. And if you go through the setup of that, you reach a point where it makes you choose which one you want to have active. And you should obviously have the one active that is for the country you are in at that point. But anybody, well, I'd say in Scotland, download Protect Scotland app. If you live in England and Wales, download the app there. And if you're travelling between, make sure you activate whichever one is relevant for the country you're in. And hopefully before too long, you won't have to worry about that, because they will operate in that joined up way. Neil Pooran from PA.
Thanks, First Minister. On Margaret Ferrier, you've asked for her to resign as an MP. If she refuses to do so, can you guarantee there's no situation in which the whip would be restored? And do you think she should have any sort of role within the SNP going forward?
The whip has been withdrawn, and I've asked her to resign. I mean, I think that makes pretty clear the severity of the position, and that is what I want her to reflect on. I am very mindful of the fact, and I don't, in all of these things, and I will make no apology for also having some, you know, human feeling and empathy. She has COVID. She's, you know, while I think she's not suffering serious symptoms at the moment, you know, she's unwell, and this is a nasty virus, and I'm not going to, you know, gloss over that. But, you know, I want her to reflect on the views that I've expressed to her, and the views that I know a number of colleagues have expressed. And I think at the moment we will allow that process to happen. Chris Green from iNews.
Thank you. Good afternoon, First Minister. As you have said, you can't sack Margaret Ferrier. Would you support a recall petition in her constituency should the conditions for this be met?
Said, you know, it's a statement of fact that no party leader can force an MP or an MSP in Scotland to stand down. You know, when you are elected to Parliament, you are elected as an individual, so parties cannot force people to stand down. What parties can do is decide whether you sit within their group or not, and the SNP has withdrawn the whip. On the recall petition thing, I'm going to be, I can't make my views any clearer here. I think she should step down. On the recall position, I'm just going to be slightly careful, because as I'm not in the House of Commons, so I'm not an expert on the House of Commons procedures, but I understand for that procedure to be available, the Standards Committee of the House of Commons has to consider things and impose a particular sanction. And given that she has referred herself to standards, it would, I think, be wrong for me to start to speculate about these processes in a way that might preempt or in any way prejudice their consideration. But, you know, I think she should step down and make all of that a moot point. Michael Blackley from the Daily Mail.
Thank you. Good afternoon. Given that Margaret Ferrier has broken the law and potentially put lives at risk, why did you take the decision to suspend her rather than expel her from the SNP, from the party? And also, in terms of what the SNP and yourself have said publicly, have you really done enough, given that a lot of people will be thinking about whether they were on the same train as her or not? Why have you not explained exactly what travel she has undertaken and what services she's been on? And will you now do that?
I will never do enough for the Daily Mail, I suspect. So, you know, it wouldn't really matter what I'd done or not done. I'm pretty sure the Daily Mail will decide it's not enough. So I'll just be pretty candid and upfront about that reality. We have suspended, or that's the process that happens first of all when an MP or an MSP is suspended from a group. They are automatically suspended from the party. You know, even political parties have to have a degree of due process, and we've done everything that I think could reasonably have been expected of us as quickly as possible. And I think anybody who takes a step back from just rank political opportunism and looks at this, you know, they will see that the SNP have acted pretty firmly, decisively. We haven't tried to equivocate and acted also pretty quickly. On the point about travel, I am not test and protect or test and trace. We have systems in place to do the contact tracing systematically and methodically. And that's what has been done. So anybody who was on a train with her who is deemed by test and protect or test and trace to be a close contact will have been appropriately identified and contacted by them and given the due advice. That is the really important and absolutely appropriate thing that should have happened, and that all has happened. So if you haven't been contacted, if you've been on a train and you haven't been contacted, it's because test and protect and test and trace clearly do not think that you fall into the category of a close contact. Tom Peterkin from the Press and Journal.
Good afternoon, First Minister. I wondered if in your conversation with Margaret Ferrier, if she gave any indication whether she would follow your advice to quit or your call to quit. And on a separate matter, given the economic devastation of COVID, what's your reaction to the closure of TSB or news of closure of TSB branches which will have a particular impact on the North and Northeast this week, bearing in mind that in the past you've backed our campaign to save bank branches?
Your first question was asked and answered earlier in the briefing. She didn't tell me in the call what she intended to do, but she's under no doubt about what I think the appropriate course of action is. Your second question I answered at some length in Parliament yesterday during FMQs. I think there are always concerns about bank closures, particularly in rural communities where access to cash and to financial services is particularly important, and we encourage banks to pay very close attention to that need for access in more rural communities or more deprived communities, and to be very careful about these decisions. And we have ongoing discussions with banks and financial services sector generally through not least the Financial Services Advisory Board, which I co-chair, and we make our views very clear on. We understand the changing pattern of how people access these services, which banks have to reflect, but we also always make the point about the importance of local access. Christine Lavelle from The Sun.
Thank you, First Minister. It was just on your conversation with Margaret Ferrier. Do you know what time on Monday she received her positive result? And were the SNP whips aware when she spoke in the Commons chamber that night that she might be going home the following day?
I don't know the exact time. These are questions that Test and Protect and Test and Trace will have gone through completely. My understanding, it was in Monday evening that she got the test result. And my understanding, although I'll double check this bit, whether this was Monday evening or Tuesday morning, that the whips were aware she was travelling home and believed that was because a family member was unwell. I understand, and it's entirely legitimate for this kind of forensic, focus on who knew what when. I'm not complaining about that, but sometimes there isn't anything untoward there. We found out about a difficult situation, got the facts as quickly as possible, and acted in a quick fashion, taking account of all of the things that we have to factor into decisions like this. And again, I can only speak for myself. I can only speak for my own party and our own actions. But I think the seriousness with which we have treated this situation, the complete refusal to try to make excuses for it, and the swiftness and decisiveness of the action that has been taken possibly stands in contrast to some other examples we've seen over the past few months. Simon Johnson from The Telegraph.
Good afternoon, First Minister. Firstly, just following up from Michael Blackley's question regarding expulsion. You said obviously there is due process to follow. However, given that she's not disputing what she did, do you think there is a strong case for the rapid expulsion of Margaret Ferrier from the SNP? And secondly, just on the timeline element, what time on Wednesday did she inform the party of her positive test? And was she asked at that time when she had first started to display symptoms? Thank you.
I don't know the answer to that particular question of exactly what time on Wednesday the whips became aware. I'll check that out and get that information to you. And your first question was, expulsion. Look, every party has due process. I really couldn't be clearer in my views about this, but even I have to allow due process to take its course, and I'm going to do that. David Ball from the Herald.
Thank you, First Minister. Going back to the contact tracing apps, have your MPs who are travelling back and forth to Westminster explicitly been asked to install both the UK and Scottish versions? And how realistic is it to now expect the public to have confidence to go on public transport, given there were already apprehensions? And you've spoken recently about the potential risk over car sharing. And quickly on students, last weekend they were asked not to use hospitality situations, including pubs. Would you advise them to do the same this weekend, given there's been quite a few students test positive? And if not, how is the situation this weekend any better?
Right, let me try and remember all of those questions. I don't know whether every SNP MP has been specifically asked to download the app in England. I would hope that is pretty obvious, but for the avoidance of doubt, not just to SNP MPs, but to everybody, download whatever app is relevant in the country you are in. This is not a competition. It is not a case of, you like one app better than the other, or one app is promoted by one government or the other. This is about public health. So I've got the NHS England and Wales app on my phone. I've not been south of the border throughout this pandemic. I've got no immediate plans to go. So I would encourage everybody to download the app wherever you are and make sure that you use it properly. And I would say to people in England who might want to listen to me, if there are anybody who want to listen to me, just as I say to people in Scotland, download your app, because it's really important that you have it. There was a question about students. I think there might have been a question before that, so if I forget about that, you can remind me at the end. The advice to students this weekend is to follow the same rules as everybody else in hospitality. That means you shouldn't be meeting in groups of more than 6. That those 6 should be from a maximum of 2 households. You should follow all of the rules on distancing and hygiene and the wearing of face coverings. And I'm saying to everybody right now, and I know it's really difficult, and I understandably, and let me just candidly say, I understand this, got messages from people in the hospitality trade when I said this earlier in the week saying, this makes life difficult for us. I know it does, and I'm really, really sorry about that. But I think all of us right now should just be thinking. I'm not saying to people don't go to pubs within the rules, but all of us should just be thinking about the numbers of interactions of that nature that we have right now, and perhaps having fewer now than we would in normal times. And I think that makes sense. Now, I think you had a third question, which I'm sorry has gone right out of my mind. Can you remind me?
Yeah, sorry. It was just what impact you believe this could have on people's attitudes to public transport.
Yeah, sorry. Look, I think there is always a danger when you've got a really high-profile case of somebody breaching the rules that people go, well, why should I bother? But the reason we all need to bother is because these rules are there for a purpose. And if we all follow the rules, in a global pandemic, I can't stand here and say anything is 100% safe and you're at absolutely zero risk of getting COVID. And that's the case with public transport, as it's the case with hospitality or walking down the street. I can't do that. But what I do know is if you follow all of the guidance, you massively reduce your risks of getting COVID. And on public transport, if all of the rules are followed around distancing, face coverings, hygiene, then you should be confident about travelling, and you should feel that you can use public transport if you have to. If you don't have to, then like many things just now, don't do it, but follow the rules, because that is what you need to do to minimise any risks of getting the virus or passing it on to others. Do you want to say more about how people can...
I was on public transport today. I cycled and got the train on a fairly essential journey to come here. There was alcohol sanitizer at every entrance. The staff and every other passenger I saw, I didn't see a single person without a face covering. The trains, I saw them being cleaned before I went on. I felt entirely safe. It is not 100% risk-free, of course it isn't, but it felt very, very safe at either end of that journey and during the journey. The only other thing I would add to the student question, if I could, is you asked what was different between last weekend and this weekend. We've put out new guidance. We've spoken to all the student associations. We've had a pause, which is what last weekend was, to kind of take a breath with the student population and say, look, this is how serious this is. I had another call this week where I spoke to the president of the National Union of Students and the principals of the universities. The support in place, I think, is more thorough and deeper than it was perhaps last week. I am confident that the students now know that guidance. We're not suggesting they can do any different. We're suggesting exactly as the First Minister said. They have the same rules now as you and I. Of course, if they're self-isolating or they're positive, they should stay where they are, and they shouldn't be out in pubs after 10 o'clock at night. They should be in small groups. They should do all of those things, and they shouldn't go back and have house parties.
Can I just take a quick opportunity to pay tribute to and thank the NUS in Scotland? I spoke to the President last Friday, but they have been hugely helpful and responsible in, being a critical friend to government where they thought we had to change things, but in helping us get these vital public health messages across to students. So I'm hugely appreciative to them. Muir Dickey from the Financial Times.
Thank you. You mentioned a couple of times that the SNP needs to follow due process on the question of whether or not to expel Margaret Ferrier. Can you give us an idea of how long you expect that process to work? And given the seriousness of the situation, do you think it should be handled as quickly as possible? And another question, if I might, looking at the overall picture of cooperation between the Scottish and the UK government at the moment on coronavirus, how would you characterise how well the two governments are working together? And what do you think are the most pressing things that could be done to improve that cooperation?
I can't give a time on due process. Look, I don't think we could have done any more really than could have been expected of us. We've withdrawn the whip. I've made clear to her she should resign. And, I think that's probably tougher, firmer action than we've seen in circumstances like this elsewhere. And it's the right action. And now, I hope that she reflects on the situation, that she reflects on what I've said to her, and that she will do the right thing. If that doesn't happen, then I'm sure we'll be having these conversations later on. But, let's just be clear here that there is no dubiety and no equivocation on the part of the SNP over this. On the question of how I would characterise relationships between the four nations, I'll just be candid. I think at this particular point in time, better than they have been at some points over the past period of the pandemic. But in some respects, probably still could be better, and that's a responsibility on the part of all of us. I had this week a very constructive call with Michael Gove to discuss the letter I'd sent to the Prime Minister the previous week about how we ensure that UK-wide or within each of the four nations, if we're having to take really quick public health action that impacts on the economy, we are also equipped with the ability to equally quickly and flexibly mitigate financially some of the consequences of those decisions. So that was a constructive call. Michael Gove, I think, accepted many of the points I was making, and we've agreed, Scottish Government's agreed to put some proposals forward, and he has agreed that we will then have some discussion around that. So, yes, I think in many respects better, and I'll keep doing my bit to try to make sure that while we will all, increasingly we'll come to different decisions depending on the state of the epidemic in different countries. Increasingly, we're coming to different decisions within each of the four nations as well as between each of the four nations. That's right and proper, but as much cooperation and alignment as we can get is, I think, for the good of all of us. And I'll continue to try to do my bit to make sure that happens. The last question today is Rachel Russell from the Daily Express.
Hello, First Minister. My question is, can you guarantee the people of Scotland that SNP MPs or MSPs will always be asked to stand down when breaching any coronavirus guidelines or laws?
I can guarantee that I will take the action I think is right and proper and responsible, and I will not stand here for party-political reasons and try and excuse behaviour. And I think I'm demonstrating that today. I'm not going to start to speculate on things that might happen in the future and what our action might be. We have to judge things on their, the circumstances that happen. But I would hope that we don't have SNP MPs and MSPs breaching the rules. I would hope that everybody was sticking to them, and particularly now will be extra sure that they are sticking to them. I know that it is, and we've reflected this, none of us are perfect. These rules can be difficult and complicated. There will be occasions where people inadvertently breach rules, and you will say to them, okay, we get that, and don't do it again. This was a flagrant and really serious breach of a rule that should not be in any doubt, and that's why it's been treated as seriously as it has been. But my encouragement to everybody, MP, MSP, anybody else, is to stick by the rules. As I say, not just because I'm saying it, not because I'm saying it, but because it's so important to help us get through this pandemic. That concludes the questions today. Can I thank all of the journalists for joining us. Thanks to Jason, as always, and to Rachel for our BSL interpretation. And thank you to you. Thank you for all the sacrifices you're making. I know how angry it makes people when they see high-profile people in positions of responsibility, not just making mistakes. Everybody can make mistakes, but breaching these rules in a way that is just incomprehensible. And I share that feeling on behalf of all of you, but also to be, a little bit sort of focused on my own perspective here, because it makes my job a lot harder at a time when it should never be an easy job, but at a time when it's got its particular challenges, obviously. So I'm sorry for having to stand here and talk about the actions of an SNP MP who breached the rules in a completely unacceptable way. But as I said earlier on, it's easy in politics to stand here and be all self-righteous about consequences when it's a political opponent. I think the test is if you're prepared to do it when it's one of your own, and I think the SNP has taken the right action, and it's because we understand how important it is that everybody sticks by these rules. So my thanks to all of you for doing that. Let me just appeal to everybody again to remember, particularly not to go into each other's houses just now. That is the key measure right now to try to stop this virus spreading. But remember all of the other advice as well, in particular the facts advice. Wear your face coverings in any enclosed space, or even just anywhere you are out and about, wear a face covering. Avoid any crowded places. Remember to clean your hands, take hand sanitizer with you, clean hard surfaces because the virus can hang around there. Keep 2 meters distance from people in other households. And crucially, if you have symptoms, get tested and self-isolate. And that applies to MPs, MSPs, everybody in the country. That is really, really important. And I'm so hugely grateful to all of you for doing the right thing. Thank you very much. Have as good a weekend as you can in these circumstances, and I will see you back here on Monday at 12:15.